Okay, so you should be able to see notes, and I'm going to be putting annotations so you can review them. And then we're going to go to the first one. So the reproductive system is primarily made out of the sex organs. Okay, in male, the sex organs is going to be the testes, and on the female sex organ, it's going to be the ovaries. Associated with the sex organs are your accessory sex organs, which are going to be made out of the glands and also the external genitalia. Okay, so just remember the way to study the reproductive system is to trace the path of this uh, egg from the ovary or the sperm from the testes so that we can follow through what we can see on those structures. So the first one is going to be the male reproductive system. I already put in this mnemonics that you can follow through. Okay, so it's tensum. So we're tracing the path of the sperm, and the sperm is actually located at the testes. Okay, so that's going to be here at the testes. That's actually our first structure that we're looking at. Okay, so the testes is where the sperm is produced. And after the testes, the sperm becomes mature. It's going to have a tail, and then it's going to go through what we call the epididymis. So the epididymis is the next organ in which the sperm will pass through. So our epididymis is the next structure. And then after that, it's going to go up through this duct. And that duct is called the vas deferens. The name of the duct is ductus deferens, but I usually call it the vas deferens because that can understand how you call vasectomy. So vasectomy is cutting off the vas deferens so that the sperm cannot become ejaculated from the male reproductive system. So the vas deferens or the ductus deferens, the next structure of our reproductive system in the male. And then the sperm now passes through the seminal vesicle, a gland that secretes semen. Now, if you want to trace the ductus deferens, you can actually see that the ductus deferens will go above where the ureter and the bladder meets. Okay, so the ureter and the bladder. Okay, if you want to see where the ductus deferens is, take a look at where the ureter connects to the bladder. You'll see that that is what the ductus deferens will be located at. So after the ductus deferens, it'll pass through a gland. That gland is going to be called your seminal vesicle. So the seminal vesicle are the ones that secrete semen. Okay, so that's the one that will secrete your semen. And there's a purpose what the semen is for. Later on, we're going to study what are the functions and what are the secretions. And then from there, the sperm now passes through seminal vesicle, will take semen in, and then will pass through this structure. And that structure is going to be called the ejaculatory duct. So from the seminal vesicle, taking out semen, then we'll go to the ejaculatory duct, and then from the ejaculatory duct, now we'll go through the urethra. So urethra is the one that will communicate to the outside of the male reproductive organ. And remember, the male urethra, it's actually made out of three parts. So the bottom portion of the bladder, you could actually see the prostate gland. Okay. Now you see that the urine passes the same path as where the sperm passes through. So this part of that urethra within the prostate gland is what we call the prostatic urethra. So the prostatic urethra is the first part of the urethra in the male. Okay, so that's prostatic urethra. And then after that, it's going to pass through this place of the urethra that is made out of muscles at the perineum. So that is going to be the muscle of the perineum. And this will be now your membranous urethra. So the membranous urethra is the next urethra. And then after the membranous urethra, the sperm now will pass through what we call the penile urethra. But here we're going to call it the spongy urethra. The spongy urethra. And later on, you can see that the reason why they call it the spongy urethra because it's located at the corpus spongiosum, the erectile tissue that is within that penis. Okay, so we call it spongy urethra. And then after the spongy urethra is going to go out here to an opening. We call it external urethral meatus. Another name for that opening is actually called the meatus. external urethral orifice, or what we call the meatus. So that's how we trace the path of the sperm from inside the male, from the testes to the outside. That is going to be the meatus. So those are the structures we're going to be identifying. Okay. Now take a look where the male reproductive organs inside is located at. It's mostly located beside the bladder, okay? And at the back of that is going to be your rectum, okay? The reason why I'm specifying this because remember, there's a way to feel for the prostate. So male would have problems such as benign prostatic hypertrophy or even prostatic cancer. So in order for us to palpate the urethra, we go through the rectum and feel for the prostate gland. Okay, and that's actually for diagnosis for such things as prostatic cancer or the benign prostatic hyperplasia. Okay, or BPH. Right. So the testes is located at the scrotum. Okay. All right. So now we've trace the path of the sperm and we identify the structures that needs to be identified on the male reproductive organs. Well, let's try to see the frontal section of the area where the testes is, and we're going to be looking at the scrotum. Okay. Now, if you notice, the testes is covered by multiple tissues, okay, and muscle, because remember the testes on the fetal stages, it used to be located inside the pelvic cavity. So I'm going to show you where it came from. So the fetus will have this as a testes. Now, if the fetus is going to be a male, that testes, okay, is going to descend down into this scrotal swelling, okay? And remember, the scrotal swelling is homologous to what we call the labia majora of the female, okay? So it actually goes into that swelling. That used to be the labia majora of the female, but since it is a male, that testes will descend down into that scrotal swelling and then will go down to become the scrotum, okay? Now, that is the testes, but if this was a female, that testes will stay inside the pelvic cavity and that will then becomes the ovary, okay? So that is becoming the ovary. So the descent of the testes will take in a lot of this tissue coming out from the pelvic cavity together with the muscle from the oblique muscles, and that's the one that will cover the whole testes. Okay, so that's the reason why you got a lot of these things that you see around the testes. So let's take a look at what are the coverings of that testes. So the first one is going to be the skin. Okay, the outer portion of the testes is covered by the skin. Okay, and then after that, you're going to see muscles located at the back of that skin. And remember, this is called the dartus muscle. So the dartus muscle is a muscle that will wrinkle or will tighten the skin of the scrotum. And that's because of incubating the testes. Testes has to have a specific temperature in order to allow the sperm to become functional. Okay, so the dartus muscle is going to be at the back of the skin of the scrotum. Okay, and then from there we're going to take a look at another covering that is going to be this covering here called the external spermatic fascia. So the external spermatic fascia is brought in by the testes about its descent. Okay, because remember, it's going to pass through a lot of tissues coming out from the pelvic cavity. It's going to produce a hole around here at the inguinal area, and we call it the inguinal ring. Okay, and then from there it will descend down, bringing its tissue together with the testes, and that part is going to be called the spermatic cord. Okay, so the muscle that is located after the external spermatic fascia is going to be the muscle that you see here. That is going to be the cremaster muscle. Now take a look where the cremaster muscle used to come from. That is coming from the oblique muscles, the external oblique muscles. Okay, so the external oblique muscles is actually the one that will be your cremaster muscle. So the cremaster muscle will pull the testes close to the abdominal skin in order to produce heat, okay? And if it's too hot, it's gonna dangle down the bottom. Now that is because, remember, the testes where the sperm are located at, it has to have a certain temperature. So the cremaster muscle can literally adjust the temperature of the sperm inside the testes by bringing it close to the body. Okay, so that will be your cremaster muscle. Now, the next structure after the cremaster muscle, okay, is going to be the internal spermatic fascia. So the internal spermatic fascia is another covering that is brought in by the descent of the testes. And then from there, you're going to have another covering called the tunica vaginalis. And remember, this actually came from the peritoneum. So the peritoneum from the pelvic cavity is actually brought down by the testes. And that, the one that covers the testes coming out to the peritoneum is called the tunica vaginalis. And the last one that will cover the testis itself like a capsule, okay, that is going to be called the tunica albuginea. Okay, so that's going to be the tunica albuginea. So whatever is inside the testes are going to be tubules. Later on, we're going to see some of these tubules. We're going to do a section of the testes so we can see where those sperm are produced. And they're produced in what we call the seminiferous tubules. Okay, so that is what we see on this area. Another thing that you have to know, okay, that the testes, since it's descend down from the pelvic cavity, it produces what we call a hole here and another hole later on from the inner portion. And this produces what we call a canal. This is called the inguinal canal. Okay, the inguinal canal is a weakness, and that's the one that will produce inguinal hernias in male. Okay, so what is located inside the spermatic cord? Remember, the spermatic cord has what we call the ductus deferens, or the vas deferens. Aside from that, there's going to be what we call the testicular arteries and these veins that look like nets. We call it the plexus of the testicular veins, called pumpiniform plexus testicular veins. And then we have some nerve fibers, autonomic nerve fibers that are associated with the spermatic cord. And those are the ones that you'll see inside the spermatic cord. Okay. So we found out that the testes, where the sperm is produced, actually came from the inside of the pelvic cavity. And sometimes this testes doesn't descend down on a male organism. Okay. So we call it cryptorchidism. So the cryptorchidism just tells you that it is hidden, and it's not hidden as well as it's hiding, but it didn't go down into the scrotal swelling. Okay, so generally, that's not a good thing. So we have to actually cut off that testes because you can't produce cancer later on. So that is called the undescended testes, right? So you can see all this stuff that is covering the testes, and that is what is very important to identify in our anatomy, right? And I said that the testes just came from the pelvic cavity, okay? It started from the pelvic cavity and fetal development, and then will descend down to this part here called the scrotal swelling. And then when it goes to the scrotal swelling, that is where the scrotum is going to be. Okay, and that is where the testis is actually going to be staying. Okay, so again, that is a history of what happened into the testes from a male organism. Okay, all right. So now we're cutting inside the testes. So the part that we're looking at is the testes. Okay, so we're opening up the testes, and you can see that the testes has a lot of these tubules. So the tubules, I'm going to draw a tubule here. Tubules have all this sperm around its periphery. And remember, the sperms will mature to have tails later on. And once they develop tails, then they're going to go through the tubules. Okay, these tubules are what we call the seminiferous tubule. Okay, the seminiferous tubule. So when the sperm develops a tail at the seminiferous tubule, that will then go into this part here. And that is going to be called the straight tubule. Okay, that's going to be the straight tubule after the seminiferous tubule. And then from there, it's going to go to this network of tubules after the straight tubules, and that is going to be called the ready testes. And then from the ready testes, it then goes through this duct, okay, that connects the ready testes to the epidermis, and that's going to be called the efferent ductule. And then after the efferent ductule is going to go now into the epididymis, okay? The epididymis has a head, and it has a body, and it has a tail, okay? So all of this are the duct of the epididymis, okay? It has a head, body, and tail, okay? And then that is where the epididymis is. These are parts of the testes, okay? And then from the epididymis, it becomes your vas deferens, and then goes to the spermatic cord, okay? And then when we trace the vas deferens inside the pelvic cavity, it's going to go and pass by the seminal vesicle. And then from the seminal vesicle, it goes to the ejaculatory duct. And then it goes to the three parts of the urethra, and then goes outside called the meatus. So we're just following tensum, okay? So that's actually what the structures are. So if you ask you the order of the path of the sperm, just follow tensum, okay? All right, so after the testes, we're now looking at the ductus deferens, or what we call the vas deferens, okay? So the vas deferens is the one that will ascend from the epididymis, from the scrotum, and pierce through what we call the inguinal canal, okay? And then after that, it slingshots above where the ureter and the bladder connects, and then turns around and passes by the seminal vesicle, okay? So the ductus deferens will take in the semen produced by the seminal vesicle, okay? And then it will proceed down to the urethras, okay? And that is the course of the ductus deferens. So the ductus deferens, or what we call the vas deferens, is coming from the scrotum, ascending up into the inguinal canal, and then goes to the pelvic cavity. So those are the path of the sperm after the epididymis, okay? And that's going to be the ductus or the vas deferens. Now, again, we have actually identified the spermatic cord, okay? And what's inside the spermatic cord is going to be the vas deferens or the ductus deferens. Another structures that we're looking at are blood vessels. That's going to be the testicular artery and the pompiniform plexus of the testicular veins. These are network of plexuses or vein located inside the spermatic cord. And then you can also see autonomic nerve fibers that are part of the spermatic cord. And then the spermatic cord is actually coming out from the pelvic, from the abdominal wall, okay? And that's what we call the spermatic cord. Now, this is what it looks like on the inguinal canal. Remember, your testes used to come from the pelvic cavity. So we'll puncture a hole here first, and that's going to be the deep inguinal ring. And then another hole will exit out from the fascia of the abdominal muscles, and that's going to be called the superficial inguinal ring. And then between them is what we call the inguinal canal. Now, if you notice, the problems with people that has inguinal hernias is there's a possibility that the small intestines can actually go through that hernia. And that can produce problems inside the scrotum. It will incarcerate the small intestines, and it can even produce your death of the small intestines, okay? So that's what we prevent. So if somebody has an inguinal hernia bulging through this superficial inguinal ring, then we will do an operation called herniorrhaphy. Herniorrhaphy is to put a mesh out there in that opening to prevent the intestines from entering into the scrotum, okay? And that's what we call the inguinal canal, okay? And then from there, we're going to be now looking at the urethra. So the urethra carries sperm from the ejaculatory ducts to the outside. In a male, there's three parts of the urethra. And if you notice that the urethra carries also the urine from the bladder, okay? And that also carries the sperm from the reproductive organ, right? So urine and sperm can pass through the urethra, but they cannot pass through at the same time, okay? Because there's valves that prevents that. So what are the three parts of the urethra? So the urethra located at the prostate gland. This is our prostate gland. That urethra is going to be called the prostatic urethra. And then the hypothalamus muscles located here, we call this area called the perineum. Okay, that is the urogenital diaphragm, and that is called the membranous urethra. Then after that, it passes through the penis, and at the area of the corpus cavern, corpus spongiosum, that will be the spongy urethra. And later on, we're going to dissect the penis and take a look at the erectile bodies located inside. Okay, but it shows you that the erectile body where the urethra passes through is the corpus spongiosum. And that's the reason why we call it the spongy urethra. And sometimes we just call it the penile urethra. Okay. So we finished with the urethra. Now we're going to take a look at the accessory glands first. Okay. Now, as I said, the sperm will carry in a lot of help from the accessory glands. The male has three accessory glands. So I need you to know what is the purpose of each of these accessory glands on a male, because they provide functions to help the survival of the sperm. The seminal vesicle, okay, will secrete what we call semen. Okay, actually 60% of the volume is secreted as semen, okay, on the male ejaculate. So what does the seminal vesicle provides for the sperm? It actually provides sugar called fructose. And that is for the nourishment of the sperm. Because remember, the sperm, when it's ejaculated, goes to the vaginal canal, and then it will travel up to the female fallopian tube to fertilize the egg. So the travel of the sperm needs to get energy, because the sperm has a tail that will need energy for its movement. Okay, so that's the first secretion that is located at the seminal vesicle. It produces what we call fructose. Then it has prostaglandin, and the purpose of prostaglandin is to suppress the immune response. Okay, now remember, the sperm is a foreign substance to the female. Okay, so it needs to get a protection by the sperm, so it prevents the female structures to produce an immune response to the sperm. So the prostaglandin is the one that will suppress the immune response. And those are the two things that are secreted together with the seminal vesicle. Now the prostate gland, and we found out that the sperm passes through the prostatic urethra. The prostate gland will also secrete about 20 to 30% of the seminal fluid, and that is for the purpose of secreting the enzyme. Enzymes are the one that will collect and then liquefy the semen. Because remember, the sperm has to be in a liquid environment, because it needs to wag its tail, or called flagellum. So the prostate gland is responsible for that, to liquefy the semen. So that's what the prostate gland secretes. Okay, and the last of the glands located at the root of the penis is called the bulbourethral gland. This is a pea-sized gland inferior to the prostate gland, and its main secretion is going to be called mucus. And remember, the mucus is for lubrication of the urethra, but generally its purpose is to neutralize the acidic urine. Because remember, the urethra also takes in your uric acid or your urine. So it will produce an acidic environment. So the bulbourethral gland secretion, called mucus, will neutralize the traces of the acidic urine in that urethra. So it actually allows the sperm to survive. Okay, so these are the three glands that are associated with the male reproductive organ. Okay, and that is going to be the seminal vesicle, secretion of fructose and prostaglandin, and that's going to be the prostate gland. Secretion is going to be the enzymes to liquefy the semen. And the bulbourethral gland is producing what we call mucus that generally neutralize the traces of the acidic urine in the urethra. So those are your accessory glands. Okay. Now, this is now looking at the accessory glands, And this is going to be at the area of the urethra. So the urethra also has secretions called mucosal glands from the mucosal glands. So along the path of the urethra are glands, and they're the one who also produce mucus. So aside from the mucus secreted by the bulbourethral gland around the urethra on its path, there's also what we call mucosal glands and submucosal glands and your main glands. Okay, so that is to actually lubricate also the part of the urethra. Okay, so that is accessory glands. Okay, and we're now putting ourselves now at the penis. Penis is called the external genitalia. Okay, the external genitalia, and we're going to be identifying the structures of the penis. It has a shaft or what we call a body. Okay, that is going to be the shaft of the body of the penis. And the tip of the penis is what we call the glans penis. It is an expanded end. The glans penis is the expanded end, which is actually the expanded end of the corpus spongiosum. Okay. And that's going to be the glans penis. Okay. And then after that, the prepuce, okay, is actually a structure that is covering the glans penis. This is actually removed, okay, on circumcision. That is the foreskin, or what we call prepuce. Okay, so the internal anatomy of the penis has three erectile bodies, which is actually made out of blood vessels. And that's the one that will actually produce what we call your erection. So erection is not due to muscular contraction, but is because of the blood vessels dilating and congesting. Okay, that is what erection is. So the three erectile bodies, two of them are located superiorly. They're called the corpora cavernosa. Okay, so these are the two erectile bodies above. And then there's only one at the bottom, inferiorly, that is called the corpus spongiosum. And remember, if you take a look at the corpus spongiosum, that is where the urethra passes through. And that is the reason why we call it the spongy urethra. Okay, the area where the urethra passes through the penis, which is located at the corpus spongiosum, is called the spongy urethra. Some books just call it the penile urethra. Okay, so that is going to be at the area of the penis. Now, the last part of the male perineum, okay, is actually going to be the description. I mean, the last part of the male reproductive is called the perineum. This is also that we need to identify in the environment of the uterus. There's a pouch here called between the rectum and the uterus. And again, the name of that pouch is the name of the structures in Latin. We call it the rectal uterine pouch. Okay, so that is the pouch that we identified between the rectum and the uterus. Now, another pouch that are located between the uterus and the bladder, we call it the vesicouterine pouch. Remember, the Latin word for bladder is also vesicle, okay, in Latin. So that tells you about the pouch located between the bladder and the uterus. That's called the vesicouterine pouch. Now, from there, we back and notice that there's a fallopian tube, or what we call the uterine tube, attached to the lateral side of the uterus. Okay, they call it also the fallopian tube. Okay, and these are the structures you see that are actually attached to the lateral side of the uterus. The distal end of the fallopian tube is where the ovary is located at. So that's going to be the ovary. Okay, and remember, where is the egg being matured? The egg is matured at the ovary. So when the ovary matures the egg, it will literally jump to the fallopian tube. And at the fallopian tube, it's going to wait for the sperm to be fertilized. Okay. And the area of the fertilization of the sperm is actually going to be the ampulla. So we're going to take a look at the different parts of the fallopian tube also after here. Okay. Now, we also need to identify ligaments. Okay. Remember, the uterus is like a puppet. Okay. So the uterus has to be suspended inside the pelvic cavity. So the first one is going to be the round ligament of the uterus. So what is the round ligament of the uterus? The round ligament of the uterus is literally the ligament that comes from the lateral side of the uterus, and it goes to the lateral side of the pelvic cavity. Ligament that you can actually see above here at the area of the ovary, that will be the suspensory ligament of the ovary. And then another ligament that you can see that is located at the posterior side of the uterus that connects to the area of the sacrum or the sacral region, that is called the uterosacral ligament. So we identified the ligaments here, okay? And now we're going to be identifying the area of the neck of the uterus. Remember, the neck of the uterus is what we call the cervix. And then after that, from the cervix, it connects to the vaginal canal. Then from the vaginal canal, it now connects to the vaginal orifice. Okay, that's the opening here. Now, if you see that the neck of the uterus has this pouch created between the cervix and the vaginal canal, that pouch, since we're at the longitudinal section, okay, we're going to call this the posterior fornix. Okay, the pouch created by the cervix and the vaginal wall, that is called the posterior fornix. The pouch created at the anterior part, okay, between the cervix and the vaginal wall, that is going to be called your anterior fornix. And then from there, it continues on to the vagina, or what we call the vaginal canal, and to the vaginal orifice. Okay, so now with this in mind, the structures where the egg will pass through starts from the ovary. That is where the egg is produced. And then from the ovary, it'll go into the next structure called the fallopian tube. And then from the fallopian tube, it connects itself to the uterus. And after the uterus, it will then, because remember, if it is fertilized in the fallopian tube, the egg will then implant itself in the uterus and it will stay there for about 9 months. But if it's not fertilized, the egg will just descend down to the uterus. So the egg will actually wait there for about 2 or 3 days for the sperm. If no fertilization occurs, it'll go down to the uterus. And remember, the wall of the uterus will gently just dissolve in a process called menstruation. So the egg will then follow down into the cervix, and then from the cervix, it then goes down to the vaginal canal, and then from the vaginal canal, it will then go into the vaginal orifice. So this is now your mnemonics. So follow through the path of the egg through these structures. Okay, just remember OFUCVO. Okay, that's going to be the path. All right. Now the structures that you see here, we're going to be describing these structures here. These are called external genitalia. Okay, so that's another part of the female reproductive organs. Okay. Okay, so you can actually see onto the lateral section. You see the clitoris here. And then we have the two lips, the labia minora or labium minus and the labium majus or labia majora. And then the fats in front of the pubic bone is called the mons pubis. All right, so now let's take a look at other sections, okay? This is a frontal section of the female reproductive organ, okay? Again, I need to identify the anatomy with this view. So the first thing is, we know that the egg comes from the ovary. So the egg comes from the ovary, and when it matures, it will literally jump to the fallopian tube, literally jump. That's called ovulation. So the first part of the fallopian tube that will catch the egg is going to be the fimbriae. Fimbriae are finger-like projections. So you can actually see here, they look like finger-like projections at the distal end of the fallopian tube, but you can also call it the proximal end fallopian tube, and you're referring from the ovary. But if you're referring from the uterus, that's the distal end of the fallopian tube. So the first one is going to be the fimbriae. Now, the egg will then go into this funnel that it looks like a trumpet. And that is the next structure called infundibulum. And after the infundibulum, it will travel down to the segment called the ampulla. Remember, the ampulla is where fertilization occurs. So if somebody asks you where does fertilization occurs in the fallopian tube, that will be the ampulla. And then at the end of the fallopian tube, which is where it connects with the uterus, that is called the isthmus. So the structures of the fallopian tube is going to be the fimbriae, the infundibulum, the ampulla, and your isthmus. And then from there, it is going to go down into the uterus. Now, in the uterus, we have three layers, okay, of the wall of the uterus. The inner layer is what we call the endometrium, okay? And the middle layer or the muscle layer is called the myometrium. Remember the word metro in Latin? Metro means uterus, okay? That's the reason I'm using the word metrium, okay? Metro in Latin is also uterus in English, okay? And lining outside of the uterus is called the perimetrium, okay? The perimetrium. Now, from there, the egg will go down to the cervix, okay? When it passes the cervix, it's going to pass through first the inner opening. That inner opening is called the internal os. Then from there, it's going to go through what we call the cervical canal. And the outer opening is called the external os. So these are the structures of the cervix. Okay. And then from there, it's going to pass through the vaginal canal or the vagina. And if you notice, because we're looking at the frontal section, this recess that you see on the lateral side between the cervix and vagina, that recess is now called the lateral fornix, okay? The lateral fornix. This is actually the fornix, except that on this view, you're looking at the frontal view, so the fornix are on the lateral side, so we call it lateral fornix, okay? All right, so aside from this, I need to identify the ligaments. Remember, the ligaments suspend the uterus and the internal genitalia inside the pelvic cavity. And if you rupture this ligaments that suspends it, it actually is going to produce what we call uterine prolapse. Okay, uterine prolapse is the uterus will then descend down to the vaginal wall. Okay, that's called a uterine prolapse. So again, I'm going to identify the ligaments, okay, that we need to identify in this view. So let me take a look and take off my labeling so we can start off with a new one. Okay, so what are my ligaments? So we identified this on the lateral view. Okay, this is called the round ligament of the uterus. So round ligament of the uterus goes from the lateral side of the uterus to the lateral wall of the pelvic cavity. Okay, so that's the first ligament, the round ligament of the uterus. Okay, remember it is the round ligament of the uterus, not the round ligament of the ovary. It is round ligament of the uterus. And then this part here connecting to the lateral wall of the uterus that connects with ovary, that will be our ovarian ligament. That's going to be our ovarian ligament. So this ligament connecting the ovary to the uterus, that is called the ovarian ligament. Okay. And again, this ligament that you see here that suspends the ovary above, that is called the suspensory ligament of the ovary. Okay, that is the suspensory ligament of the ovary. Now, if you go to the lateral side, the ligament looks like a cape. Okay, you can actually see it's extended until the area of the cervix. Okay, so this is called the broad ligament. Okay, so the broad ligament is divided into three parts. And remember, the terms are just descriptions in Latin. Okay, remember, ligaments is called meso. Okay, they're called meso. And then fallopian tube in Latin is called salfingo. So salfingo means fallopian tube. So the part of the broad ligament that suspends the fallopian tube, that part is called the mesosalpinx of the broad ligament. Okay, and the part of the broad ligament that suspends the ovary, that part of the broad ligament is called the mesovarium. Ovary means ovarium. Meso means ligament. Okay. And the last part of the broad ligament is called the mesometrium. Remember, I said that metro means uterus. So the mesometrium is the one that suspends this uterus down here as part of the broad ligament. Okay. And that's called the mesometrium. Right. And then we're going to be taking a look at the ligament down below the broad ligament, that is to the lateral side of the vaginal wall, and it goes to the cervix. This ligament is called the cardinal ligament, or what we call the lateral cervical ligament. Okay, it extends down to the vaginal wall. Okay, now between the broad ligament and your cardinal ligament is the uterosacral ligament. We saw that on the lateral view. Okay, that's going to be the uterosacral ligament. So what are the ligaments that we need to identify here? Let's start off with the round ligament. So the round ligament is the ligament on the lateral side of the uterus to the lateral wall. And then after that, we have the ovarian ligament connecting the ovary to the lateral side of the uterus. And then after that, we have the suspensory ligament of the ovary, pulling the ovary upward, suspending it. And then we have the broad ligament that is on the lateral side of the uterus. And it actually is made out of three parts: the mesosalpinx, the one that suspends the fallopian tube; the mesovarium, the one that helps in holding the ovary as part of the broad ligament; and then the mesometrium, the one that helps in positioning the uterus. Okay. And after this, we have what we call the lateral ligament, lateral cervical ligament, which is going to be also called the cardinal ligament. Okay. The one that extends down to the lateral side of the vaginal canal. And then the last of that ligament is between the broad ligament and the lateral ligament. That is going to be your uterosacral ligament. Okay, so a lot of ligaments for the female reproductive organs because we want to suspend and pull the uterus upright inside the pelvic cavity. Okay, so these are your structures for this view. Okay, so again, identify the ligaments and identify the structures of individual internal genitalia. Okay, and which is here the uterine tube. Okay, this is our uterine tube, which is made out of your fimbriae, infundibulum, the ampulla, and the isthmus. Okay, that is our uterine tube. This is what you see on normal, okay, hysterectomy of the uterus, and this is going to be your uterine tube here. Okay. All right. So now after this, we're going to concentrate on uterus now. And if you take a look at the uterus, the dome-shaped structure above the uterus, we have a certain name for that. We call it the fundus, the rounded superior portion. And remember, the fundus, when a woman is pregnant, we use the fundal height between the top of the fundus to the pubic bone. The height tells us the age of the fetus, okay? So that is the age of the fetus. So we call it the fundal height. Because at that age, it's going to actually be hard to take a look at the exact age yet because we need to do an ultrasound. An ultrasound is the exact age of your fetus, okay? But since it's about 3 months, then we're going to use the fundal height, okay? And then the part of the uterus that has a neck, we call it the cervix, okay? And we identify that as the cervical canal with internal os and external os. This is your, this is your internal os, external os, and the cervical canal, okay? So that's actually the structure of the uterus. And remember, it lies anterior to the rectum, posterior to the bladder, and it is, the useful position is called anteverted, or sometimes called anteflex, okay? The abnormal version is going to be retroverted. That's an abnormal position. All right, after this, okay, we did look at the vagina. And if you notice that the vaginal wall has corrugations because it can actually expand, okay? So the walls are corrugated because it can expand. And that's actually the structure next after the cervix. That's going to be the vagina. And remember, we have the fornix also identified here. Since we're looking at the frontal view, the lateral fornix is actually the fornix between the vaginal wall and the lateral side of the cervix. That's called the lateral fornix. And the term hymen is actually an incomplete diaphragm. Because remember, the vaginal canal opens up into areas. The vaginal canal has an opening coming out from the outside, and then there's a canal that starts out from the inside. So these two will meet up to actually form what we call the vaginal canal. And the area where they meet up will produce a incomplete diaphragm, and that will be the hymen. Okay, and that's the reason why we actually know what a hymen is, because that's where the vaginal canal will actually meet up. Okay, because it just didn't come from the inside, it also comes from the outside in fetal development. Okay, and that's what we call hymen. All right, after the vagina, okay, let's go back here and should be able to see all the structures that we identified, okay, and go through all the structures of the organ, all the structures around the internal genitalia, and identify the ligaments, okay, on this view, okay. And now we're going to the area called the external genitalia, okay. External genitalia, if you notice, it is located the diamond-shaped structure called the perineum. This is called the perineum, okay. And that's the reason why on the male, you only see an anal orifice. On the female, you see 3 orifices. One from the anus, the other one is going to be from the urethra, and then next is going to be the vaginal orifice. So on a lithotomy position, this position here is a female on a lithotomy position on the stirrups. The most superficial orifice is going to be the urethral orifice, starting out the superior, and in the middle portion is the vaginal orifice, and then at the inferior part is going to be the anal orifice. So that's how it's positioned. Okay. So again, this is the perineum, the diamond shaped area is called the perineum of the female, and the female has three orifices in that area. Okay. All right. So now take a look at some of the structures we can identify here. So the area between this part called the clitoris located on top. Okay. Remember, clitoris also has a skin hood called the prepuce, similar to what we have in the penis. And the clitoris is actually the glans penis in men. So this is actually literally similar to the glans penis in the male. Okay. It also has a skin above the clitoris called the prepuce. Okay. And then we have the two lips called the labia majora, major lip. Okay. This is actually the scrotum in men. Okay. That is the scrotum in men. And then we have the labia minora, the minor lip. Okay, so the area that you see from the clitoris down to this terminal end at the inferior portion called the fourchette, okay, it's called the vestibule. Okay, and then the last one is going to be the flat area on top of the pubic symphysis. That is called the mons pubis. Okay, that is called the mons pubis. Right, so these are the structures of the external genitalia of the female perineum. Okay, differentiated from the male part, and that male part has what we call the perineum with only one orifice. That is called the anus. Okay. All right, so we're going to start with male first, and we're going to take a look at all the reproductive models, description of all that is stated here. Okay, so we're going to go start off with our testes. And then at the back of the testes is going to be the epididymis, and they're located within the scrotum. Okay, and then we're going to follow our epididymis going up into the vas deferens or the ductus deferens. This area is called the spermatic cord. And if you trace the ductus deferens, that's the area between where the ureter connects with the bladder. So that's how you look where the ductus deferens is. And here you can see the seminal vesicle. Okay, you can see the seminal vesicle, you can see the prostate gland below the bladder, but you won't be able to see the ejaculatory duct and the urethra because we need to actually put it in a section. Okay, so we got to open up to see those structures, right? So whatever you see here are the ones labeled here. Okay, now here, this generally actually shows you what the seminal vesicle looks like. Okay, it is a gland where the vas deferens passing by to the prostate gland. Okay, so this is what the seminal vesicle is on the model. And then here we can actually see that the seminal vesicle is on a section. It was cut open. And then after the seminal vesicle, the next structure here, that is going to be your ejaculatory duct. Okay, that is your ejaculatory duct. And then after the ejaculatory duct, you're going to see the urethra. And since this is located around the prostate gland, that urethra is called the prostatic urethra. Okay, so that is going to be your prostatic urethra. And then you can see the inner side of the bladder here. Okay. All right, moving on, next one. Okay, again, it shows you about the seminal vesicle and the ductus efferens passing by the seminal vesicle. That's about it. You can see the ejaculatory ducts is not seen here. You have to actually take a look at it on a cross section. These are your spermatic cord made out of the testicular artery. And then your veins, we call it the pumpiniform plexus of the vein. Okay, and that includes the ductus deferens, or what we call the vas deferens. Okay, all right, next here, this is now a section that we can see after the seminal vesicle. So this is your ejaculatory duct, which is the structure before the urethras. Okay, and this would be the prostatic urethra. And then after the prostatic urethra, it's going to pass by here on this urogenital diaphragm, the hamacal muscle. That should be a membranous urethra. And after the membranous urethra, you would see that this is going to be the spongy urethra. And remember the erectile bodies, the one on top, that's going to be your corpora cavernosum. And the one at the bottom, where the spongy urethra is, that is your corpus spongiosum. And we can see that the glands that are visible here, the bulbourethral gland located at the root of the penis, and then the prostate gland below the bladder. Okay, remember the seminal vesicle is also the gland, but it's not seen on this section. Now this gives you another idea of the ejaculatory duct seen here. Okay, and then prostatic urethra. Then after the prostatic urethra is the membranous urethra. And then after the membranous urethra, you have the spongy urethra, enclosed by the corpus spongiosum. And then the bulbourethral gland located at the root of the penis. Okay, and you have the prostate gland here. Okay, next one. Oh, now this actually shows you about the penis, regions of the penis. You have the root of the penis, the body of the penis, and the tip of the penis is called the glans penis. And remember, this is the distal end of the corpus spongiosum. That is actually called the glans penis. All right, now this shows you about the urethra at the corpus spongiosum. That is going to be the spongy urethra. Then it shows you the testes. At the back of the testes, it's described as a comma-shaped structure called epididymis. Okay, and then here it shows you the corpus spongiosum, inferior erectile bodies wrapping the urethra, and then this is your corpus cavernosum. Right, so next, we're looking now at the cross-section of the seminiferous tubule. So all of these are tubules, they're tubes cut in the cross-section. So this is going to be the lumen of the seminiferous tubule, that's the cavity. Remember, this connects into the epididymis. And if you notice, the cells that are around the seminiferous tubule, it doesn't have tails yet, so they're actually developing sperm. Okay, we call it spermatocytes. And then once they develop the tails, okay, that is going to be called your spermatids or spermatozoans, and they're going to be entering into the lumen. And then once they enter the lumen, it's going to be transported now to the epididymis. Okay, so this is what a seminiferous tubule looks like. Another view of the seminiferous tubule. If you notice that the most inner part of the cells, they have tails ready. These are called your sperm, mature sperm. So they're the one entering into the lumen. Okay. Another view of a microscopic view of the seminiferous tubule. You can see also that the mature sperms already have tails inside, so they're entering into the lumen. Okay, transported from the seminiferous tubule down to the epididymis. Okay, so we finished with the male reproductive system. We're going to be looking now at the female reproductive system. Okay, so we finished with the male. Now our organs are stated here. that we need to identify. Okay. So first, I'm going to look at my uterus and the neck of the uterus. We call it the cervix. Okay. And then after the cervix, it connects to the vaginal canal. Okay. And you can see that the bladder, okay, is in front of the uterus. And you notice that the urethra of the female in the bladder, okay, after the bladder is actually short. Okay. It's about 45 inches short. Okay. And then at the back of the uterus is going to be the rectum. In front of the uterus is going to be the bladder, urinary bladder. And to the lateral side is going to be the fallopian tube. And then the ovary is seen close to the fimbriae of the fallopian tube. And you can still see on this section, you can still see the external genitalia, the labia majora, labia minora, and the clitoris. Okay. And then here it's going to be the mons pubis, the mons pubis. All right, so now let's take a look at another view. Okay. This is the external genitalia that we're identifying on this section. The labia majora, the labia minora, and the clitoris, the erectile body of the female. Okay, that is going to be the external part of the external genitalia on this section. Now we're going to be looking now at ligaments here. Okay, remember this is the fundus of the uterus, the dome-shaped structure of the uterus. Now this is the fallopian tube, or what we call uterine tube. Okay, and then you see the ovary inside here, and the ligament that is attaching the ovary to the uterus, that is called the ovarian ligament. Okay, and then you can also see the ligament that is on the lateral side of the uterus attaching itself to the lateral walls of the pelvic cavity. That is going to be the round ligament. Okay, so ligament is very important on this picture. Okay, and now we have the uterine tube with the ovary, and this should be the ovarian ligament. And then this should be the round ligament here. Okay, another view. Let's take a look at some of the regions of the fallopian tube. Okay, and the region of the uterus and the layers of the uterus. So just remember the finger-like projection of this fallopian tube. It is called fimbriae. Then it connects to this structure. They describe it as a trumpet-shaped structure, infundibulum. And then the whole thing here is called the ampulla, where fertilization occurs. And the connection of the fallopian tube to the uterus is called the isthmus. Okay? So these are the general structures of our fallopian tube. Okay, again, uterine tube here, ovaries here. Right? So here it tells you about the cervix. Here, the cervix, the dome-shaped structure of the uterus, is the fundus. And we're going to be identifying parts of the cervix. The inner opening is called the internal os. The outside opening is called the external os. Then the canal between the openings, that is called the cervical canal. Okay, now the pouch between the bladder and the uterus, we call it vesicouterine pouch. And then the pouch between the rectum and the uterus, rectouterine pouch. Okay, Moving on to the next one. Okay, the three layers of the wall of the uterus. The inner layer, this part here, the inner lining of the uterus is called endometrium. Remember the word metro means uterus in Latin. And then the muscle layer, that's going to be your myometrium. And then the outer layer, it's called the epimetrium, or sometimes called the perimetrium. Okay, so those are the structures that we see on the walls, the three layers of the walls of the uterus. Again, the layers of the uterus, endometrium, the lining, myometrium, muscle layer. Remember, the endometrium is the one that will erode in menstruation. Okay, and then the outer lining is epimetrium, or sometimes called the perimetrium. Okay, so here I'm gonna concentrate more on the ligaments here. Okay, so number 13, connecting the ovary to the lateral wall of the uterus, is gonna be the ovarian ligament. And then number 15 is the one that suspends the ovary, called the suspensory ligament. Okay, so those are the two ligaments that are visible in this area back here. Okay, and then we're looking now at ovary. Okay, so this is a slide of an ovary. So all these things that you see here are the developing egg. Okay, the egg is the one that's located inside. Okay, this follicle. So follicle is the developing egg. Inside is the oocyte, which is the egg. Okay, so that's what it looks like inside the ovary. So in humans, you usually have 2 or 3 developing, but apparently there's one that's going to be pushing through. Okay. Now this is another picture. This is called the Graafian follicle. Inside the Graafian follicle is the egg called oocyte, and it's surrounded by cells. This one that surrounds the oocyte is called the corona radiata, and there's a cavity with fluid inside. That's going to be called the antrum. Okay, so that's actually what it looks like inside the ovary, where the egg is being developed. Again, another picture of the oocyte, the egg around the area here, covered by a lot of cells called the corona radiata, and follicle cells around it. And a cavity with fluid is called the antrum. So that is called the ovarian follicle.